My wife and I, we decided it was time to try to have children, and we were looking into options. It costs a lot, right, to go into IVF, to go into the process, especially for same-sex couples to have a baby. And when we were discussing, financially how we were going to afford this, the policy that the healthcare facility had was that you would have to be involved, with a man, and you would have had to have been trying for over a year to get pregnant. So, they suggested in order to get reimbursement, you can try to write a letter, the both of you, saying that you have been trying for over a year with a man. We were totally shocked and we said, this seems like, first of all, the system is broken. You're asking me to lie, but is that morally right? Is that, something that you really want same-sex couples to go through? And the staff was supportive. It almost was like they didn't even know they were leading us into these situations. How could we change it? It's, the healthcare facilities, talking to the insurance companies. First education, and then doing direct initiatives, taking action and, advocating for real change. The ideal interaction with a healthcare provider would be right first when you walk into a healthcare facility. There needs to be gender-inclusive language on forms. I can't tell you how many times that I have seen mother, father, husband, wife. Providing first gender-inclusive language, I think, is easy. Teaching healthcare providers maybe what's the best way to interact with LGBTQ plus patients. They could be advocates, and that they could, root for the underdog and actually do something that could change this, so that emotional journey that we're on is not so challenging. So, that's why I'm sharing my story, and I hope this makes a difference.